Supporting grieving siblings can often be challenging for families for many reasons. Immediately after the death of their brother or sister, siblings may feel excluded or forgotten due to the number of arrangements that need to be made. Children can face complex stresses following the death of their sibling, and this can be further complicated if their brother or sister faced a prolonged illness. Children often form their own image of death of their sibling, which may or may not be correct. For this reason, it's important to provide basic, accurate information about their sibling's death, as research tells us that in many cases, those imaginary visualisations can be far worse than the truth. For example, if they argued before the death of their brother or sister, the sibling may feel that they are to blame for the child's death. While we know that this is untrue, a child can build this up in their imagination to the point where they completely believe this is a fact. This is why it's important to keep siblings updated with age-appropriate factual information. It's important to use language that is simple and honest. Saying he or she is dead or died is better than saying that they are sleeping. This can be confusing for younger children who can be very literal and need to understand that being asleep is not the same as dead. The experience of bereaved siblings differ from child to child and also depend on age and developmental stage. Younger children will need constant reminders that their brother or sister has died. They do not understand that death is permanent. We hear quite regularly of siblings who ask their parents if they can go to hospital to visit their brother or sister, despite being told that their sibling has died. Older children and adolescents may withdraw into themselves and want to spend time alone. This is normal and okay. It's important, however, to make sure that siblings of all ages have a safe way to express their grief. This might be talking to a family member, using creative strategies like drawing or journaling, or enjoying an activity they used to do with their sibling who has died. The important part is keeping present the memory of the child that has died. Some other ways to help a child who is grieving include creating a safe space for your child to ask questions whenever he or she is ready. Remind your child that they can ask you a question at any time and you will answer it honestly. Be a good role model. Take time to talk about your loss with your other children. Share your feelings and cry if you need to, because it gives children the courage to share their own feelings and shows them healthy ways to grieve. Be receptive to whatever they say and keep in mind that this is their way of grieving. Don't stop their feelings or try to protect the child from feelings of pain and loss. You can't hide feelings from children, no matter what you say and do. Give the child something to do. For example, plant a tree to memorialise their sibling who's died. Write a story about their sibling. Take flowers to the grave or read children's books that deal with loss so that they know that their feelings are normal. Children will tell you how they feel, usually through their behaviour. Don't push the child to talk about it, even though you know it's good for them to express their feelings. Keep in mind that children can only handle bits and pieces of grief at a time. Don't associate tears with grief, because some children cry, whereas some do not, but both may be equally affected. If you're concerned about a child who is grieving, it's important to contact your GP or a local counsellor who can give you more advice and guidance.